Good morning. Thank you for joining us today to discuss HIV screening and pre-exposure prophylaxis. My name is Karen Curtis, and I'm a provider outreach and education specialist here at WPS. Joining me today is Tom Ryan. Tom is going to help me out today by monitoring the chat for questions that you may have and also providing some additional information during the presentation. Now, I do have a couple of things to cover before we get started. The Training Center webpage is where you can find information related to Provider Outreach and Education team. You can find a link on this slide, and it's also going to be added into the chat. Now, once you are there, you can choose the live events card, which will bring you to a list of all of the webinars that we're holding for the next 6 to 8 weeks. You can register for upcoming events and download copies of the presentation that we show during our webinars. Now, if you haven't gotten your copy of today's slide deck, there is still time. Just click on the link in the chat to get you there quickly. Our training center is also the home to our Encore presentations webpage. Videos are available for up to 90 days, and they can be watched directly on our website. After that time, they will be removed from the website, but they will remain on our YouTube channel until the information changes. Later, there will be a question and answer session if time permits. So if you have questions that are related to today's topic, please send those using the chat. If there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent out to everybody in attendance. At the conclusion of today's webinar, you will be asked to provide feedback on how I did today. This is your opportunity to let me know what I did right, as well as where I need improvement. There is also an opportunity to provide topics that you would like to see us cover in future education. So while this is a CMS survey, WPS does look at our results, and we do our best to make the changes that you ask for. Now, here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. For this reason, the CMS website should be checked for updates, and the federal regulations will take priority over anything presented today. Questions are answered based on the facts given. Any changes to that information could change the response. If you have a claim-specific question, we do ask that you contact customer service. They can access your claim and they can provide an answer based on how your claim processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. We're recording the event so that it can be posted as an encore presentation. That way, if there's anything that you feel maybe you missed or you want to look at again or share with a coworker, that will be available later. This is the American Medical Association copyright notice for CPT codes. During this presentation, I will provide billing information that does contain CPT codes. So this notice just lets you know that Medicare does not own CPT codes or their descriptions. We have one more copyright notice for you. This is from the American Hospital Association National Uniform Billing Committee. This notice is required since I discussed coding that would be included on a UBO 4 or 837I. The American Hospital Association is not responsible for, nor were they involved in the preparation of this material or the information provided today. So now let's get started with the actual webinar. My hope today is that I can increase your knowledge on coverage for both the HIV screening and PrEP. I plan to do this by discussing a little bit about Medicare coverage of preventive services in general. Then I'll move on to specific coverage and billing of today's topic. Finally, we'll talk about eligibility and how you can determine if it's time for a beneficiary to receive these services and avoid frequency edits. So we'll start with a little background information. The Affordable Care Act and the U.S. Preventive Services Task Force, or Task Force, have helped make preventive services more accessible to beneficiaries. The Affordable Care Act was signed into law on March 23, 2010. It required healthcare plans to provide certain services, immunizations, and screenings without cost sharing. The hope was to eliminate some of the out-of-pocket expenses so that more individuals would be open to receiving preventive care. This act also increased access to services that by making it unlawful for any healthcare provider who receives federal funding to refuse to treat individuals based on race, color, national origin, sex, age, or disability. The task force is a volunteer group that was created in 1984. The 16 members consist of national experts who come from a variety of fields, including family medicine, behavioral health, and nursing, among others. Now, these individuals make evidence-based recommendations regarding preventive services that are offered in a primary care setting or services that are referable by a primary care clinician and that apply to patients who have no obvious signs or symptoms of a specific disease. Now, each service is reviewed to determine if there is evidence that the service is effective and the balance of benefit versus harm. A letter grade is then assigned, and those that receive a grade of an A or a B are offered without cost sharing. So currently, the task force is in the process of updating their information on HIV screening, but their current recommendation is that clinicians should screen all pregnant women, including those who present in labor or at delivery whose HIV status is unknown, adolescents and adults aged 15 to 65 years, and younger adolescents and older adults who are at increased risk of infection. These recommendations did receive an A grade, meaning that there is a high certainty that the net benefit is substantial. Now for PrEP, the recommendation is that clinicians prescribe pre-exposure prophylaxis using effective antiretroviral therapy to adolescents and adults who are at increased risk of HIV acquisition to decrease the risk of acquiring HIV. This service also received a grade of an A. Now, I always like to include some statistics in my preventive services webinar, just so everyone can see how important these services are. Today, a little over 1 million people in the U.S. have HIV. About 13% of them don't know, which is just one reason why screening is so important. In 2023, 39,201 individuals received a diagnosis of being HIV positive. Men aged 25 to 34 account for a large number of these new cases. 66% are men who have participated in sexual activity with other men, while 6% are attributed to injection drug use. There were 4,496 HIV-related deaths in 2023. The majority were males between the ages of 55 and 64. I also found in my research that the South has the highest rates of new infections and deaths. Researchers attribute this mainly to concentrated poverty along with lack of access to healthcare and preventive services. So let's move on and let's start talking about Medicare coverage. HIV screening is covered for all individuals between the ages of 15 and 65, adolescents younger than 15, and adults older than 65 that are at increased risk, and pregnant beneficiaries. So you can kind of see that Medicare took those recommendations from the task force and used pretty much exactly what they said to use. For non-pregnant patients, screening is covered annually. Now, when Medicare uses the term annually, they mean 11 full months must have passed since the last test. So if a beneficiary received a test in January of 2025, then you're going to start counting that 11 months beginning in February. So this means they'd be eligible again in January of 2026. Now, pregnant patients are allowed 3 tests per pregnancy, once at the time they are diagnosed as pregnant, once during the 3rd trimester, and once at delivery if ordered by their clinician. So I've discussed individuals at increased risk when talking about recommendations from the task force and again when discussing Medicare coverage. But what does that really mean? CMS has defined increased risk to mean men having sex with other men, those who have unprotected sex, injection drug users, sex workers, or those who have a partner who is a sex worker, individuals whose past or present sex partners are HIV positive, bisexual, or injection drug users, as well as patients who are being tested for other sexually transmitted infections. Now, patients can voluntarily request an HIV screening. They would also be considered in this category, or it may be recommended for those with new sexual partners. Individuals who received blood transfusions between 1978 and 1985 are at increased risk. This is because prior to 1985, there was no HIV antibody screening test for donated blood. Lastly, a physician may determine that a patient should be screened for HIV based on conversations and examination. Pre-exposure prophylaxis, or PrEP, is the use of antiretroviral drugs to prevent HIV in individuals at increased risk. The determination of whether an individual is at increased risk for HIV is made by the physician or healthcare practitioner who assesses the individual's history. Along with the drugs, Medicare covers additional preventive services that includes up to 8 individual counseling visits every 12 months. These counseling visits are going to include HIV risks, HIV risk reduction, and medication adherence. Counseling must be furnished by a physician or other healthcare practitioner, and individuals must be competent and alert at the time the counseling is provided. Medicare will also cover up to 8 HIV screening tests every 12 months and a single screening for the hepatitis B virus. So we've discussed what is covered, and now we're going to look at how we should get those claims sent into Medicare. The codes listed on the left are used to report what type of screening was used. Code 80081 is for an obstetric panel, and that would only be applicable if the patient was pregnant. If the obstetric panel code is used, there are certain tests that must be included. The Medicare Preventive Services tool does give details, and we'll look at that when we get to the resource slide. All claims must have a primary diagnosis of Z114. One of the pre-submitted questions I received asked why individual screening tests have different diagnosis codes that basically say the same thing. Why can't there just be one code that covers all screening? And the simple answer is for tracking purposes. When ICD-9 was switched to ICD-10, there are nearly 5 times as many diagnosis codes. And according to the World Health Organization, this information is used to support payment systems, resource allocation, and provide health statistics. Now next, when we look at the secondary diagnosis code, you'll see it's broken down into pregnant beneficiaries, beneficiaries aged 15 to 65, or beneficiaries under 15 or over 65. If you are billing for a pregnant beneficiary, there's many secondary codes that you could choose from. Codes are first broken down into the type of pregnancy. So you have first normal pregnancy, and then high risk. And after that, the codes are broken down into different trimesters. So normal pregnancy is further broken down into other normal pregnancy and normal pregnancy unspecified. Codes for normal pregnancy would be used when you know that this is not the patient's first pregnancy. Normal pregnancy unspecified would be used when you can't determine if this is the patient's first pregnancy or not. Now, if the patient is between the ages of 15 and 65, a second diagnosis is not required. Beneficiaries who are at increased risk would have a secondary diagnosis which further identifies the specific behaviors. So these codes are going to include high risk heterosexual, homosexual, or bisexual behavior, and code Z7289, which is for other problems related to lifestyle. This would include things such as substance abuse. Now, failure to report a primary diagnosis code of Z114 and a secondary diagnosis code, if it is required, will result in the test being denied. If you submit claims on a CMS 1450 or UB04 or an 837I, you will want to use one of the types of bills you see here. The services should be billed using a revenue code in the 300 range for laboratory. You will submit, if you submit your claims on a CMS 1500 or an 837P electronic equivalent, you will want to include a place of service 81 for independent laboratory or 11 for office. Codes for billing PrEP services are broken down as shown here. The J codes listed first are for prescription drugs that are used to prevent HIV infection. Code Q0521 is a pharmacy supply fee. Codes G0011 and G0013 are for counseling. G0011 is for individual counseling done by a physician or a qualified healthcare professional. G0013 is individual counseling done by clinical staff. Again, counseling is going to include risk assessment, risk reduction, and medication adherence. Finally, we have code G0012, and that is for the PrEP administration. Now, for applicable diagnosis codes, I did include a link to the Medicare Claims Processing Manual, Chapter 18, which is for preventive services. The list took up to 4 pages in the manual, so I thought it would be easier just to provide a link. You will notice that everything in that section for PrEP is italicized and in red. These policies were effective September 30th of 2024, and they were implemented April 7th of 2025. So the manual updates are pretty recent, which is why they're italicized and red. You're also going to see the diagnosis codes listed out in the Medicare Preventive Services tool, which we'll look at soon. I do want to take a moment to talk about specialty billing for HCPCS G0011. Critical access hospitals should bill on type of bill 85X using revenue codes in the range of 96X, 97X, or 98X. For rural health clinics, G0011 should be billed with modifier CG on a type of bill 71X. And then for federally qualified health centers, you should bill G0011 along with the appropriate FQHC specific payment code, which is the G0466 or G0467, and those would be on a type of bill 77X. Now, PrEP for HIV counseling HCPCS code G0011 is considered a visit for RHCs and FQHCs when it is furnished by an RHC or FQHC practitioner. Eligibility is another topic that I always like to cover in my preventive services webinar because these services are subject to frequency edits. I definitely want to take the opportunity to help you avoid claim rejections. There are a couple of options when it comes to checking patient eligibility. We have the WPS Secure Net Access portal, which is often referred to as the portal. Users must be registered with WPS to view a beneficiary's eligibility information. When you visit the WPS webpage, there will be a box that takes up the majority of the screen. This is where you can register or log in if you already have an account. The HIPAA Eligibility and Transaction System, or HETS, is available for both Part A and Part B providers, and it provides access to eligibility data in a real-time environment. The option involves submitting files via electronic data interchange, so a trading partner agreement is required. Providers, clearinghouses, and third-party vendors can transmit a 270 request, which will be processed, and a 271 response will be received. Response files are accurate at the time of the transaction and should not be interpreted for guarantee of payment. So here you're going to see the information that can be found on the portal. The top shows all of the tabs that can be found when performing an eligibility check in our portal. The blue means that there is information available, while the gray means that there's no information for those particular tabs. The information at the bottom of the screen is the HIV screening information as it is shown on the Preventive Services tab. So you can see it has the procedure code listed, it'll list any modifiers, next eligible date, and then if there's a deductible or any deductible remaining or coinsurance amount, which these services, there is no cost sharing, so there shouldn't be anything there. I've also included example of the data that will be returned on the HETS 271 response file. HETS already supports HCPCS code G0475 for HIV infection screening, but effective with the July release, HETS will additionally support 6 new HIV PrEP codes. So that's going to be the G0011, G0013, G0432, G0433, G0435, and the 80081. So those are some new codes that were added that you'll get information back on. So that's really going to help with those frequency edits. Now, I have provided a couple resources that I hope you will find helpful. I do want to take a look at the first two. Now, Tom, can you verify that you can see the Medicare Preventive Services tool?
Yes, Karen, I can see it.
Great, thank you. So this is a tool that I include in all of my preventive services webinars. You can see it has everything listed. I personally think that this is a really good tool, which is why I include it. You can see here we got the HIV PrEP and the HIV screening. This circle with a T means that it is a telehealth service a bit that's optional for that. I'm sorry, I'm not saying that right. I'm going to click on that one first. You can see it's telehealth eligible. It does give you a link right here at the top to the NCD, which is connected with these services. So you can click on that and it'll give you the information found there. It also broke the codes down. So you have for the PrEP for HIV codes, the supply code, counseling, the administration. Here it did list out all of the ICD-10 codes that are applicable for those tests. It gives you a summary of what Medicare covers. It also gives you the frequency, lets you know that there's no patient responsibility. And then it also has some notes down here. So it has a note about the HCPCS code J0799, some things that are going to be coming, or I'm sorry, things that started September 30th of 2024. So I just think it's really helpful and it gives you some extra information. If we go back and select another service, for the HIV screening, same thing. You have a link directly to the NCD. Here we had talked about the obstetric panel. It does say that this panel must include the following, and it gives you the specific tests that should be included in that panel. The diagnosis codes, Medicare coverage, frequency. So again, I just think it's a very good tool and I think it's very helpful regardless of what preventive service you're looking for. The second resource is the CMS resource for PrEP. This I thought would be very helpful. It tells you what Medicare covers, who's eligible, what's my role, who can bill. So it gives you some specifics about that. What do I need to know about billing? Gives you some tips in there. So I just wanted to make sure I showed you those because I thought that they could be very helpful for you. I also included, of course, the Medicare claims processing manual, and Chapter 18 is for preventive services. So I believe that I answered all the pre-submitted questions during the presentation. So I'm going to ask Tom if anything has come through in the chat.
Karen, we do have one question in the chat, and it says, are PO and PN modifiers required for these CPTs HCPCS when billing from a provider-based outpatient hospital?
With all of the information that I found with all of the instructions on how to bill for these services, there was nothing mentioned about those modifiers.
So those two modifiers do represent outpatient provider-based departments. So they're required, and not to counter Karen, but they are required. The reason they're required is it has nothing to do with being prevented. It's the it's the outpatient provider-based department that requires them. So it's not preventive related. Those are billing related for outpatient provider-based departments. So yes, you have to use them. It doesn't, preventive is not an exception. It's not an exception, nor unless Karen, you know of, did it list an exception and said these are not required? If not, then yes, they're required.
No, I did not find any exceptions, and I appreciate that additional information.
And that actually was the only question we got.
Okay, great. Thank you. We will go ahead and move on. Now, after the close of today's webinar, you should receive a thank you for attending email. There are two sections that I would like to draw your attention to. The first section, titled Your Opinion Matters, will give you another opportunity to provide feedback if you have not already done so. The second section, titled Certificate of Achievement, gives you proof of attendance and contact hours, and that can be submitted to your accrediting organization for continuing education units. Now, if you do not get this email, please check your spam or junk folder. You will also need to add messenger@webex.com to your safe sender list to avoid these issues in the future. Now, if you joined only by phone, WebEx is not able to generate this email. So if that is the case, we ask that you send an email to the education mailbox. Please include your name and the phone number that you used to join so that a certificate can be sent to you. Now, if you do think of any questions after the webinar, you have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff knows that your question is related to this webinar, and we'll send it directly to me. Remember that if your question is claim specific, those should go to customer service. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Tom add a link into the chat, and I really do hope that you'll take a moment to provide feedback on how I did today. The redirect looks like what you see here at the bottom. We don't have control over how this appears, so we just want to let you know it isn't spam or anything malicious. Now, we have made some recent changes based on survey comments. Chapters were added to our Encore presentations and YouTube, so these timestamps can be found in the description, and it kind of breaks the webinar into different sections or topics of discussion. Not only does that give you an overview of what's being covered, but it's going to allow you to jump to the points of the video that you're interested in most, or if you want to review something, you can just easily jump back and review it. Training indicators were recently added to the description of our webinars to help you decide if the material applies to you. Although you can usually tell from the title, training indicators can provide additional details. We've also started holding Medicare Education Expos. This is a day that is dedicated strictly to one topic. So in July, we had one that was on Medicare policy, just because we've had so many surveys that have asked for education on LCDs and NCDs. So that day we held 5 webinars. They were all dedicated to the LCD, NCD topic. If you were not able to attend, those recordings are available on YouTube. But I also want to let you know that we are holding another one on October 16th. It's going to be dedicated to the life of the claim. So if you're out here at the WPS website, you click on the training center. And sorry, now it's going to go slow for me today. There we go. We'll go to live events. And I'm sorry if scrolling bothers you, just look away for one moment. I got to get down here to October 16th. So October 16th, We have our webinars listed here. You just click on the registration link. This one, like I said, is going to be the life of the claim. So it gives you all of the webinars we're going to hold, a description, and then it gives you a little link there that you can register. So if that's something that interests you, be sure to go check that out and get registered for some of our webinars. Well, that brings us to the end of today's presentation. On behalf of myself, Tom, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.